Welcome everyone. Thank you for joining us today. Today we have our fitness and pregnancy webinar with Tanya Smith from Hartford Hospital. I'm going to let her get right into it. So type any questions you may have throughout the presentation into the chat box, and I can always ask them to her at the end. And don't forget to stay muted, and that is it. Thanks, guys.
All right. Hi, everyone. My name is Tanya Smith. I am a certified nurse midwife working for Hartford Hospital. I spend a good amount of my time at the Women's Ambulatory Center on Park Street in Hartford seeing patients, and also in the triage unit at labor and delivery. And I am here today to talk to you about fitness and pregnancy. So today we're going to cover some myths and misconceptions about exercise and pregnancy. We're going to talk about what the actual recommendations are and the benefits. We're going to talk about some pregnancy issues like managing and hopefully preventing the diastasis recti, and also dealing with round ligament pain, which is a really common pregnancy discomfort. We're going to talk about some specific exercises to have a good pregnancy, and also training for the delivery itself, and some special considerations for pregnancy. And then we'll have a Q&A at the end. So I'm going to start with some myths. First off, it's not safe to exercise in pregnancy, as I'm sure something you've all heard in the past. But to the contrary, World Health Organization, American College of Obstetrics and Gynecology all feel that women with uncomplicated pregnancies should be encouraged to engage in aerobic and strength conditioning exercises before, during, and after their pregnancy. So this is associated with minimal risk to the pregnant mother, the baby, and has plenty of benefits for everyone else involved. Of course, my little disclaimer here, every woman should have a conversation with their provider about their unique situation and make sure that exercise is going to be safe in their situation. But generally speaking, on complicated pregnancies, you should be able to participate. Why is this important? So physical inactivity is the fourth leading risk factor for early mortality worldwide. And in pregnancy, this really isn't much different. When you're not moving around, you're more likely to gain weight. You're more likely to have lots of other complications like gestational diabetes and hypertensive disorders. Concerns that physical activity may cause miscarriage, poor fetal growth, injury to the pregnant woman, premature delivery, all have been unsubstantiated. So this is, uncomplicated pregnancies. So the recommendations put out by the World Health Organization are that pregnant women with uncomplicated pregnancy should do about 150 minutes a week of aerobic exercise. That can be spread out throughout the week. You can do a variety of different aerobics and muscle strength training, like lifting weights, resistance training, things like that. And you really should limit the amount of time that you're being spent sedentary. Getting up and just moving your body, going for walks, all really going to be very beneficial. Studies have shown that exercise during pregnancy can reduce your overall weight gain through the pregnancy, significantly reduce your risk for developing gestational diabetes. Hypertensive disorders like gestational hypertension, preeclampsia are more likely to be reduced. Low birth weight babies, preterm deliveries, and the risk of C-section deliveries all will decline with staying active through pregnancy. You're just overall going to have a better experience with your pregnancy if you stay active. So just the reports of a lot of the aches and pains that are common with pregnancy are going to be decreased, specifically back pain, sciatic, all sorts of discomforts. And then also depression. This is a common time for women to suffer with depression throughout their pregnancy and also into the postpartum period, and staying active and getting those endorphins are going to help reduce the risk of this as well. So definitely lots of reasons to keep moving. Myth number 2, exercise in pregnancy can lead to miscarriage. So again, we really haven't found any correlation between low risk pregnancies and moderate intensity exercise and miscarriage. And to the contrary, physical activity has actually been proven to have a protective factor in pregnancy. So you're actually increasing your odds of having good outcomes. Myth number 3, you should not allow your heart rate to go above 140 when you're pregnant. There is no one targeted heart rate that's set for every pregnant woman. You really have to just pay attention to how you're feeling. Cardiovascular exercise can improved placental function, oxygenation to the baby. So you certainly don't want to avoid the cardiac activity. You want to get your heart rate pumping, but you want to make sure that you're not going too far. And to do that, you can do the talk test. So you should be able to have like a basic conversation, at the peak of your activity. If you feel super winded, unable to speak, you're excessively sweating, feeling lightheaded or dizzy, you're obviously going too far and just need to back down that intensity a little bit. Also important to work out in a climate controlled environment and making sure that you're staying hydrated. Hindsight, I should have done a whole additional slide on the importance of hydration in pregnancy, because it's one of the things that I spend a huge amount of time talking to every single patient about. I think as a society, we don't drink nearly enough water. And when you're not pregnant, your body has so much tolerance for that. But once you're pregnant, you're going to know it. And you really got to make sure that you're hitting the minimums. So the recommendation is drinking about half of your body weight in ounces. So if you're 200 pounds, that's 100 ounces of water a day that you want to get in. And then if you're working out and sweating, spending a lot of time in a warm environment, you've got to replace that fluid in addition to that 100 ounces. So making sure that you're well hydrated before you start exercising, sipping water throughout the process, and then again, making sure that you're recovering and replacing all the fluids lost afterwards is seriously important. All right, and then myth number 4, do not do core work during pregnancy. This myth originates from the fact that you have all your abdominal muscles in the center of your abdomen when you're not pregnant. So typically when you're leaning forward to do a crunch, you're activating those muscles. During pregnancy, every woman has some element of separation of those muscles. So you're really wanting to focus more often to the laterals to exercise those muscles, but it's still super important to do it. So when you're thinking about core work, it's not just your abdominal muscles, but the entire midsection of your body. So wrapping around your back. And there's actually a correlation with the pelvic floor muscles when you activate your abdominals. So you can imagine through pregnancy, this is really important. Going to help with a lot of back pain and pelvic discomforts during pregnancy to maintain that core strength. And you can imagine preparing for birth, having a good strong pelvic floor is going to help with that as well. You definitely need to make some modifications. So, at the beginning of your pregnancy, you might be able to easily do sit-ups the way you had before and the core work that you were doing. But as you're starting to see that separation and your belly is poking through there a little bit, just got to do some modifications. And we will talk about that a little bit later, what type of exercises would be good for this. Myth number 5, pregnancy is not a good time to start a fitness routine. And I would say that that is absolutely wrong. This is the perfect time to get healthy, and not so much just fitness. Look at everything in your life. It's time to clean up your diet, make sure you're getting enough sleep, reducing the stress in your life, hydrating, avoiding toxins like drug and alcohol, and then also staying active. If you have not been active at all up until this point, again, you want to discuss with your provider, but starting off small, swimming, walking, things that are lower impact, and then just building as you go. You can incorporate some strength training with some lighter weights, and then just keep amplifying as you're moving through your pregnancy and feeling stronger. If you were already super active prior to getting pregnant, again, discuss with your provider. In the beginning, you might be able to continue on with what you were doing and then just needing to make adjustments as the pregnancy advances. All right. Now, avoiding diastasis recti, and I know this is a common concern. Most women will have some degree of separation. So you can see in this photo where the 2 abdominal muscles kind of have a separation and there's a little bulge around the belly button there. That space is created to make room for the pregnancy, and typically postpartum will recover on its own. Usually when patients come in to see us at 6 weeks, they still have like a 2 to 3 centimeter separation that over the course of a few months will improve on its own. You're more at risk for this if you're a little bit older, or if you've had multiple pregnancies back to back and really haven't allowed time for your body to recover sufficiently between pregnancies. Prevention, the best thing you can do is keep your core in shape. So making sure that you're getting those exercises in and keeping those muscles strong during the pregnancy, and then again, postpartum, as you're going through that recovery period of time.
Hey, Tanya, can I jump in there?
Absolutely.
Thanks. Hey, everybody. I'm sorry. I don't know if you guys had introductions in the beginning, but I'm Dr. Hartnett, and I'm the medical director here at the Women's Ambulatory, and I work with Tanya. And I'm happy that she's doing this talk. This is great because these are all the questions we get all the time. And I think they're great things to address. That last slide where she talked about the diastasis of the rectus, pretty much. So in this picture, you can see the outline of the muscles are a little bit separated, but then you also see the excess skin. So two different issues there. And, you know, the excess skin, sometimes younger people, you know, bounce back a little bit quicker. Your skin tissue has more elasticity in it, and that will help. And then for the rectus, strengthening the core definitely helps that. It helps, you know, tighten up the muscle, but the layer that's behind the muscle is the fascia. And that is the tissue that is responsible, you know, basically for keeping the insides on the inside and the outside on the outside. And when that is stretched, or if there ever becomes a little bit of a space in that or a hole, it's called a hernia. In this particular picture, I'm going to guess that this patient also has an umbilical hernia. So there's a couple things going on there. And, you know, to a certain extent, even as much as core work you do, it's excellent, but it cannot fix fascia. So if you have an issue where after having a couple, 3 pregnancies, that diastasis is very bothersome and you've done core work, sometimes the only way to fix that is a surgical, where they pull the fascia, it's called plication, pull that fascia together to close the gap. It's not a life-threatening problem, and luckily it's not, because, you know, I think most pregnant women suffer from a certain degree of that. And if you've ever been pregnant before, I'm not sure if this is your first pregnancy, second, or if you're not even pregnant. You know, people say, God, you know, for my second pregnancy, I feel like I popped at about 8 weeks or 10 weeks. And what happens with each successive pregnancy is that fascia does stretch a little bit. So each time you get pregnant, or even if you have more gas or feel bloating, your belly does pop out a little bit more quicker and easier, because that fascia, which was once very tight, after a pregnancy, it is not as tight. And, you know, you do go back to more normal after your pregnancy, but often it's a newer normal, and it's slightly different than from where you started out. And I'm sure Tanya can attest to that. Being a
3
provider,
babies later, yes.
I think you've had a few kids yourself.
I have.
So, you know, we could talk about some of this stuff afterwards. And, you know, if you identify yourself in your situation, that's great. And if you don't want to, you can put it in the chat box and we can talk from there too. Okay. All right. Sorry about that, Tanya.
That's okay. No, thank you. All right. And so then the next thing I was going to talk about is round ligament pain, which is also a super common pregnancy discomfort that typically starts around the 2nd trimester. You have 2 ligaments that are supporting pretty much the entire weight of your uterus. So as your uterus starts getting a little bit bigger, it's putting a lot of pressure on those ligaments. So typically what pregnant patients will notice is they'll cough or sneeze or get up too quickly and turn and like put a lot of pressure on those ligaments, get a sharp stabbing, shooting pain to let you know that you injured it, and then kind of a dull ache for a few days. Pain will go away and then you'll do it again. You're not creating any harm, but it can be scary and can be uncomfortable throughout the pregnancy. The best way to avoid this and try to improve the comfort is, again, in keeping those abdominal muscles and that core strong to kind of take some of that pressure off of those ligaments. You may also want to consider something like this, a prenatal cradle. This is something that potentially could be covered by your insurance, so you might want to talk to your provider about it. And it's basically like a bra for your belly. So as you're getting a little bit further along, it gives you some support. Might be super useful to wear something like this when you're actually exercising, or if you know, on your feet a lot during the day working, you could wear something like this. This will help decrease the incidence of that round ligament pain. Also, hopefully the diastasis recti by not just allowing a pendulous hang of your belly, but also will take the pressure off of your hips, your legs, your back, everything. So you can always chat with your provider. I do know they sell them on Amazon as well if you want to just go out and get it for yourself, but this is an option.
some people like that and some don't. I think it's just a matter of comfort.
Mhm.
There is some data that it might help, but not real strong data. So it's more what is comfortable. It's comfortable for you. And it's, you know, the same thing. If you happen to have a C-section, you can get like an abdominal binder in the hospital, and it just kind of holds things tight.
Mhm.
So if you cough or move, it like Tanya said, kind of buffers, like shock absorber.
Mhm.
And again, some people like it, how it feels, some don't. I'm one of those people, like I hate Spanx. I just hate that tight feeling. So I pretty much would figure I'm not going to like that.
Yeah.
But it's a personal preference. So again, you know, explore that with your provider.
I think it's different for every pregnant woman too. So like when you're having your first baby and those muscles are tight and your pregnancy is being held close to you just by your own muscles and support, you may not find this super helpful. But baby 2, 3, bigger babies, you know, when you feel more of that belly just kind of hanging forward, that extra additional support might help out quite a bit. So just like Dr. Hart had said, it depends a lot on your specific situation and whether or not it would be helpful. All right. And then some special considerations to just keep in mind as a pregnant woman. One, your center of gravity is shifting. So as your belly gets bigger and starts pulling forward, that's going to throw off your balance. And you pretty much need to plan for this. You're just going to be clumsy and be much more susceptible to tripping, falling, slips. On my shifts in triage, it's very rare that we make it through a whole day without seeing somebody come in after having some type of fall, especially in the winter. So when you're planning your workouts, you want to make sure, you know, that you're in a safe environment, that if something were to go awry, you're not going to fall very far. This might not be a great time to take up step aerobics and be tripping over a step and things like that. So just really kind of planning that you're going to be likely a little bit more clumsy. We already talked about the importance of maintaining hydration and not allowing your body to get too overheated. Want to wear loose fitting clothing, avoid extreme heat and humidity, and making sure you're hydrated before, during, and after. Laying flat on your back. So this becomes an issue right around the 20-week line. So the halfway mark of your pregnancy, your uterus is now big enough that when you are lying completely flat on your back, it actually compresses some blood vessels that are flowing below that. This can decrease blood flow leading to the uterus and can also make you feel kind of crummy. So you might notice right away you feel a little lightheaded, dizzy, nauseous. Simply adjusting and tipping off to the side usually will relieve your symptoms right away. Best to avoid this altogether by not laying flat on your back. So if you're doing an exercise that requires that, just shoving a little pillow or a blanket or some sort of wedge underneath one of your hips just to displace a little bit off to the side resolves this problem altogether. Some women are really sensitive with this. The minute they lay back, they get sick right away and might have to spend, move a little bit more to the side to get good relief. But a little tip is all that's necessary. And then avoiding injury. This is not a good time to be playing touch football or on your soccer team. You don't want to have any situation where there could be any risk of injury to your belly at all. So you don't want to be, even just something simple as riding a bike where you're relying on balance could be super dangerous during pregnancy. So assess the situation, make sure you're not taking any risks, and just keep your feet on the ground.
Hey, Tanya, I just want to add on that. That's perfect. I wrote a little note, contact sports. Some of this is common sense. And obviously, you're horseback riding, you're afraid of, we're afraid that you may fall like that.
Mm-hmm.
That's going to just hurt you. And of course, most likely the pregnancy, the baby is pretty well protected inside of you. It has your abdominal wall, which may or may not have a little bit thickness to it. You have the uterus, which is also a very thick muscle in there protecting the baby. The injury often occurs to the placenta. And the placenta is the lifeline between you and the baby. And it's kind of a, unless there's a heavy duty impact, like in a car accident, often it's not the baby that is injured in these types of falls or whatnot in a pregnancy. It's the sharing effect with the placenta. So if there's a fall or even like a car accident, what happens, you have that acceleration, deceleration of your uterus, and then the placenta in the uterus. And the placenta can tear inside, and those blood vessels that are connecting the uterus and the placenta can be torn, and you can get some bleeding in there, and that's again, it separates, you know, the blood supply, which is the oxygenation to the baby, and that's, you know, what we're worried about. And if you have a you know, a fall or a car accident, we will usually monitor you on labor and delivery if you're over 24 weeks for 2 to 4 hours, because at that time we will see if there's any evolution of symptoms, mainly on the monitor, that would be suggestive of an injury to the placenta. So that you know, contact sports, that makes sense. You know, speed skiing, that's not a great thing to do if you wipe out, whether you're pregnant or not pregnant, actually. And you know, the scuba diving with the changes in pressure, and it affects the fetal oxygenation curve, which there's reasons with all the physiology that take place during pregnancy, why these things are just really not a good idea. And then again, you have specific one-offs, you should talk to your doctor about that.
Yeah, and to just back up what you said there as well, like if there is an incidence where you have some type of trauma to your abdomen, whatever it is, from exercising or like a motor vehicle accident, it's definitely a good time to reach out to your doctor and see if you do need any additional testing or monitoring. All right, so here are some exercises for core work that you can do during pregnancy. Just like I'd mentioned before, your core has got a good connection to your pelvic floor, so this is something that you definitely want to work during pregnancy. Can help reduce back pain, urinary incontinence before, during, and after. So all super important. Love this cat-cow pose right in the middle here. When you're on all fours, kind of pulling your abdominal muscles into your core and arching your back, and then doing the opposite where you push everything forward and kind of look up. Really going to feel good for your pregnant back. Some balance exercises like the bird dog and this bottom corner here, and the wall sits, help for that. You can also do the bridges where you're lifting your bottom off the floor from laying on your back position. And then planks. So just being on your hands and planking, and also doing a side plank where you could modify it by putting that bottom knee down as well. And then exercises to prepare for labor and delivery. You know, when I think about this, I'm thinking mostly about your pelvis and being able to abduct your legs properly. And then when you're like in this deep squat, like on the center of the slide there, this position is really opening your pelvis, allowing a lot of room for the baby to turn and move, descend into your pelvis. It's going to help the baby get into a good position. At the later part of your pregnancy, could actually help you get into labor by having your baby's head push harder onto your cervix. So deep squatting, these deep lunges or the butterfly pose, all good for hip mobility and allowing that movement. Child's pose where you're leaning backwards there is good also for your hips as well, and taking pressure off of your back. So a great place to hang out, you know, in that late term of your pregnancy. And then I just left, you know, kind of a slide here indicating like prenatal yoga. I think that there's a lot to be said for just basic yoga moves, especially in that late third trimester. If you get to a point where you're finding, you know, cardiovascular activities and strength and all that stuff is just getting to be too much, really just focusing on mobility, balance, breathing, stretching, those are going to be super beneficial, especially, you know, when you're preparing for labor and delivery. So just keep moving, I think, is kind of the key. Warning signs. Oh, actually, sorry, I wanted to go back. You know, I put in some exercise there about core and also about preparing for delivery, but those are just kind of specific exercises to think during pregnancy that would be beneficial. But truthfully, there is no limitations to what you can do as long as you're factoring in the safety piece of it. So if you wanted to join a dance aerobic class, or you wanted to continue running, or you wanted to take up a weightlifting program or whatever, all of these things can be done safely through pregnancy, but I would discuss it with your provider, make sure you're making the modifications as your body is changing throughout the pregnancy, and then listening to your body. If something doesn't feel good, you're, you know, not feeling great afterwards, you know, you need to modify or discontinue. So some warning signs that things might not be going well. If you are noticing any vaginal bleeding, abdominal pain, or cramping after finishing your workout, it could be just an indication that you've gone too far. Obviously, you're going to chat with your provider, but you want to make sure that you are replacing the fluids that you lost. Nice cool bath or shower can sometimes help, resting in a cool environment. And then if these things continue, of course, checking in with your provider. But these also could be just signs that you've pushed too hard and you need to make some adjustments for future workouts. And then make sure you're feeling good before you start. So if you're having any chest pain, shortness of breath, dizziness, headaches, leg pain, muscle weakness, anything like that, check in with your doctor before you do your workout that day and make sure that everything is okay. So some key points, basically, exercise in pregnancy and staying active is very much recommended for uncomplicated pregnancies and has many positive outcomes for the pregnancy and even for the delivery, reducing the rate of C-section deliveries. Definitely should talk to your provider, make modifications all the way through your pregnancy, making sure you're staying hydrated, avoiding overheating, and making sure that you're avoiding any unintentional traumas or injury to your belly. That's pretty much all I had. I could open up to questions if anybody has any.
I will also put a few questions that we had for registration in the chat box as well.
Okay.
I know someone
We
had
did
asked.
get some questions, and I think some of them were answered throughout the talk, but
Yeah.
if there wasn't, there was something that wasn't, please do. You know, just so I know, the audience we have here, this is Raytheon, correct?
Yes.
And this is a support group you have within Raytheon, or who is our audience here?
So this is all of our employees throughout Raytheon Technologies. And I am the fitness specialist here at Raytheon as well. And so I have worked with a couple of people on the call, working with them now, part of our webinar series.
Okay, great.
Someone had asked, what are some workouts that you would suggest for a second pregnancy body where pelvic floor issues are still lingering and perhaps could be a little bit worse with a second pregnancy?
Yeah, so back to that core work. You definitely want to do those core work because it's going to help with those pelvic floor muscles, but even just basic Kegels and things like that to kind of reinforce that pelvic floor throughout the pregnancy. If you're already starting where you're having some issues like urinary incontinence and things like that, the additional weight from the pregnancy is likely to make that worse as things go along. So I would definitely, start with Kegel exercising, maintaining good core health, avoiding excessive weight gain, stuff like that through that second pregnancy.
And I would add to that, Kegel exercises as the pregnancy goes on will be very, very difficult. And probably you'll have to wait till postpartum to fix that. And I think I would just ask a little bit more qualifying question is, when they say there's still pelvic floor issues, what does that mean? But what kind of pelvic floor?
I know if anyone wants to type into the chat, you can send the questions to me and I can also ask them.
Sometimes that means feeling pressure. Sometimes that may feel for them, they have prolapse. They have some pelvic prolapse, pelvic organ prolapse. Sometimes that may mean some urinary incontinence. So just clarifying what that may mean. And most of those things, like prolapse, that will progress with each pregnancy. And I would recommend not to get that corrected if it's bothering you until you're done having children, because it will just recur.
So for something like if it was more leaning towards the incontinence side.
The incontinence you can help correct during the space between pregnancies. And there's different kinds of incontinence. There's a stress incontinence, which is people will leak urine with a cough or a sneeze. And then there's like an urgency where you're just sitting there or or you're coming, this happens often with cues, or something will trigger it. Like you put the key into the door to get into the house and it's like, oh my God, if I don't get in here in 2 seconds, I'm gonna wet my pants. Or like there's some sort of trigger like that. There's different treatment for each of those types of problems. The cough and sneeze is because of the stress on the pelvic floor. And the pelvic floor, as I always explain to patients, is kind of like a hammock. You know, if you think through evolution, we were really 4-legged animals, and now we're upright on 2 legs, and there's constant pressure on our pelvic floor even when we're not pregnant. It's not a very good design. And then when we get pregnant, it stretches out the pelvic floor. After you deliver, it comes back, but never to where you started. So many people are able to, with core exercises and pelvic floor, there's actually pelvic floor physical therapy that you can go to, usually outside of the pregnancy, that can help strengthen those muscles. And for many people, that's enough so that you're not symptomatic in that you're leaking urine. If not, then there's other, there's other treatments available, both surgical and non-surgical. So for the basics, you can do some core exercise, because what the core strength does is it helps compensate for the pelvic floor. And you can do some Kegels and pelvic floor type of strengthening, but as the pregnancy progresses, it's harder to do that. You know, you have 30 pounds sitting, you know, on that pelvic floor, and that's hard.
Yeah. All right. Thank you. We did have a question that someone said, what was the concern with the calf pain on the previous, the ending slide?
Yeah. So during pregnancy, you're in a state where it can be more common to develop blood clots. And so typically when that happens, it would be in your calf that you're noticing that. That's the most typical place for it to develop. So this is not a common thing by any means. It is a slightly higher increased risk during pregnancy to have things like this happen. So if you're noticing any swelling or pain in your calves, you want to get it looked at before becoming active.
And as Tanya mentioned, one of the signs of that is swelling. What pregnant lady doesn't have swollen calves? Mm-hmm. All of them do. We all do. This tends to be one-sided, one leg significantly more swollen than another, pain behind the calf, hurts to touch, hurts to walk on it. So if you're concerned, and usually a red spot, mm-hmm. It could be a spider bite, because that's also what a spider bite would look like. But if you have that type of symptom, swelling, hurts to touch, or hurts to walk, you should definitely reach out to your provider.
All right, any other questions, anyone?
Any questions about delivery? Sometimes we get questions about that. Okay, I see a question here. What age is considered a risky pregnancy? So by definition, 35 years and above is considered advanced maternal age. Now, nowhere in medicine is that considered advanced age 35. Okay, that's crazy. In obstetrics, back in the 80s, the number 35 was determined as the cutoff, because at 35 years old, your risk of having a Down syndrome baby or a baby with a genetic abnormality was about 1 in 300. Also at the time, this is the 80s, your risk when you had an amniocentesis, because that was really the only test available back then, because we had just started with the triple screen and quad screen didn't come until the 90s. Your risk of having a miscarriage from having an amniocentesis was 35 years old, was 1 in 300. And that was the same as the risk of having a chromosome problem at 35. So that was the break-even point. That's the number they used. We'll probably never change that. So as you get older, the reason that is considered riskier pregnancies, really more for your risk of high blood pressure increases with age, your risk of diabetes increases with age, Your risk of miscarriage increases with age because the eggs are older. So all risks for pregnancy, it increases every year. It just gets a little steeper as you get into your mid and later 30s. That being said, we have many patients who deliver late 30s, early 40s that have, are fine and have pregnancies that are okay. But just statistically, as those numbers increase with different complications, it's the cutoff's 1 in 35. And quite honestly, Connecticut has the highest percentage of pregnancies over 35 years old. And, I think that's a couple reasons. I think it's one, we have a fairly wealthy state, and there's a lot of professional women who put off childbearing till a little bit later in life. And we also have UConn, which is the third most productive REI center in the country. So I think those two factors give us that statistic.
That's great. I had another question that was, we've heard that some IVF pregnancies are often induced at 39 weeks. Do we know why that is, or is that standard at all?
It's not standard, but there was a recent study that came out a few years ago. It's called the ARRIVE trial. And there's debate of whether inducing all pregnancies at 39 weeks and above, since that was considered term, if it decreased or improved maternal outcomes or fetal outcomes. And the timing of delivery is always a unique decision with providers. We don't typically induce someone less than 39 weeks because that's not considered term, and then there's risks of having the lungs immature for the baby and some breathing problems and other issues. But we do induce people who have high blood pressure typically before 39 weeks, and also people who have diabetes. And it's always a risk balance, benefit balance to see when the optimal timing is. So not all IVF pregnancies are induced at 39 weeks.
Awesome. We have another one that says, are the yoga poses showed also good or okay to do during delivery? And on top of that, do you have any best poses or anything like that during delivery that you guys would recommend?
Whatever you can do.
Whatever you can do.
When I think often it's hard to be completely prepared for your delivery. I've done probably, I'm not even sure at this point, 3,000, 4,000 deliveries, maybe more. And every delivery is different. So I often find, or sometimes, for first deliveries, and maybe Tanya, when you were still delivering as a midwife, you may have seen this. Sometimes first times moms will come in with like a 4 or 5 page birth plan of exactly how this birth is going to take place, and different lighting, different music, different poses, showers, tubs, like all sorts of things. And it goes off the rails like in the first 2 hours. So, maybe something happens, or it's just hard to predict. So if you can walk during labor, great. We have also different, we have balls that you like, the birthing balls to sit on and the peanut to help open them. Like, whatever works for you and whatever you feel comfortable doing at that time, you could go for it. And as long as the baby looks good on the monitor and the baby's tolerating labor, we won't really give you many restrictions. There's 2 patients here, you and the baby. So we have to kind of delicately balance both of those. Sometimes as you get further along in the labor and the pain really sets in where the baby is, coming down into the pelvis, you may only be able to lay on your side, or you may only be able to stand up, and it will be different for each of you depending upon what nerves are activated and how that's tolerated. And sometimes, many times mom will come in, we don't want epidurals. We're like, okay, we will support you in whatever you would like to do and however you'd like to manage that your pain management in your labor. But it is hard to forward think on something that you've never experienced before, right? So the pain from having a baby is like a kidney stone. And, they did this study once, and sometimes when we're discussing this in labor, the patient will come in with her partner or her mom or somebody, and the mother doesn't want the patient to have an epidural, or the partner says, no, don't get the epidural. Well, it's hard to imagine that kind of pain unless you've actually had it. And, they've equated, when they've done some studies where they put all these electrodes in laboring mom's head and measured the amount of pain fibers fired during a labor. And it's equivalent to getting your fingers amputated. So I would ask my patient when she said, should I get it? I don't want to feel like I failed at this. I'm like, oh my God, would you ever get your finger chopped off without getting pain medication? So of course the answer is no. And there's nowhere else in the hospital that you negotiate pain medication. So you should do whatever works for you, which is the long answer to your short question of what yoga pose you think would be beneficial. Whatever you feel the most comfortable doing, because during labor, it might feel very different as the baby starts descending through your pelvis of what is comfortable and what is not. The only recommendation I would have for you in labor is, and actually starting off and being a parent, is you just need to be flexible, because as much as you plan for one thing, the other thing is potentially, could happen. And you're just going to have to go with the flow, and being a mother, I think that's probably your motto. You got to just go with the flow. Does that somewhat answer your question, Chloe?
Just to add to it a little bit more, I also feel like you should really listen to your body as well. So I think that when those, especially the early parts of your labor, when you're home before you come into the hospital, if your body is telling you to squat, you should squat. Like those cues, your body's going to give you hints on how to get your baby lined up in the best position and to help move your labor along. So in the beginning part, even if you're planning on having an epidural, like staying active, getting into these different positions, sitting on a birthing ball, doing some squats and lunges and all that is going to help actually make your labor go along a little bit faster and get your baby into a good position. So as much as that you can do before you even get an epidural, if that's your plan, will help, expedite your labor.
Okay, so when you're trying, so does this mean when you're trying to conceive a child, or when you're already pregnant?
No, when I'm trying. So at the minute I'm trying. So when I'm trying, I can do all the exercises.
Sure. When you're trying to conceive, when you're trying to get pregnant.
Yeah.
Yes.
Yeah, there shouldn't be any activity restrictions at this point. Do what you've been doing, make sure you're as healthy as you can be, and then as the pregnancy takes on, you may need to make some modifications as things go along.
Okay.
And, as Tanya said, there's, even if you're fairly inactive before getting pregnant, you start an exercise program during pregnancy. It's fine. You're just going to have to start out slow. You're not going to start off training for a marathon if you've never exercised before. It's always better to get in better shape or become more active prior, but no time like the present.
Exactly.
Yeah. No, usually I do a lot, but when I'm trying, I kind of like stop that week. I feel like, okay, I'm not doing anything. And then then I was like, okay, no, maybe that's not the right thing to do.
Mm-hmm.
So
you don't have to.
I don't think your body's going to be upset if you miss a week, but if you're like still keeping moving, even just going for light walks during that time when you feel like you don't want to push so hard, it'll be enough.
okay. And do you not recommend like wearing like high heels during any time of the pregnancy?
No, if you're comfortable and you can fit your feet in them, you should be able to wear them.
Okay.
Might just get harder as your feet get swollen to fit into nice shoes.
Absolutely. All right, had to wear Crocs to a job interview because I was like 37 weeks pregnant and there was no way heels were working.
Tips for getting active again after delivery.
So, I mean, part of it depends on the type of delivery you had. If you had a C-section, you know, that's major abdominal surgery and you're going to need a recovery period. So I would definitely have you talk to your provider about that. But typically we don't want to start up any major activities after a C-section till about that 6 to 8 week mark and, you know, your body's healed. And then you're going to just start slow and build back up. You certainly cannot jump back into where you were before you had the baby. For vaginal delivery, your body heals up a lot faster. You might find after a week or two, you're ready to jump back in. So definitely just starting with walking and then building up your endurance as you go along and then paying attention to how you're feeling. Sometimes in the postpartum period, you know, if you're pushing a little too hard, you might see an increase in vaginal bleeding, which is just a warning sign that you're doing too much and you need to take it back a little bit. So I think until you hit about the 6 week line, you probably just do some basic activities to keep yourself moving, but not, you know, super intense cardio unless you get clearance from your provider ahead of time.
And we do, even with vaginal delivery, you can start walking, you know, after those first few days, but you don't want to do heavy exercise like heavy jogging or lifting weights, because that pelvic floor is coming back together. And by you lifting weights or doing heavy exercise, you're not allowing that healing.
But you can lift the baby, is it?
Oh yeah. Yes.
Baby plus car seat. You'll be doing a lot of lifting.
You say 15, 20 pounds after the C-section and even the vaginal delivery for those first couple of weeks.
I have another question which I've sent you as well.
The vaginal dryness question. So vaginal dryness isn't a huge issue during pregnancy, but can be a substantial issue postpartum. The hormones that you know, you're producing when you're breastfeeding can cause vaginal dryness. So, you know, at any point this can happen. It can be affected by our moods and arousal level and all of that. So if you're having issues with it, you know, just using a good lubricant, especially through intercourse and things like that, can, you know, compensate for this, especially while you're breastfeeding.
Okay. I also have another question, because when I speak with a couple of people, like my friends who already had who already like gave birth to kids, I get like mixed feelings, because most of the people had like vaginal delivery and then they end up saying like, oh, it's really painful. So maybe like just go for like a C-section or something like that, because some of them had suffered for like 8 hours or I don't know, 10 hours straight with pain. And some had like really bad experiences. So I don't know, my mind kind of, it's like really confusing. I'm not pregnant yet, but still these are like little questions which is like sitting in the back of the head.
Absolutely. When you have a vaginal delivery, you're doing all of the pain and the work up front. And then when you have your delivery, typically you feel pretty darn good afterwards and your recovery goes much quicker. With the C-section, you're doing most of that work at the other end of it. So you can go into your C-section feeling pretty darn good. And then now you're having abdominal surgery and you have a recovery period. So you can imagine the recovery is a little bit harder. Plus with the C-sections, you're creating scar tissue to your uterus and surrounding organs. And, you know, you don't want to, if you're planning on having multiple children, you don't want to get yourself into a situation where you're now having 4 and 5 C-sections, because that will just increase your odds of complications and difficult deliveries and things like that. So ideally having a vaginal delivery, you know, is where you want to head for. I don't know that I would plan for a primary C-section. I'm just trying to avoid discomfort, because I think no matter how you look at it, you're going to have some discomfort, whether it's before or after.
Okay. So the preparation is what it matters then. All the mindfulness and meditation should help a little bit, I guess.
Absolutely.
And you know, think about this. People have been doing this for millions of years. Like, and it is painful. There's no doubt about that. There's things we can do for pain. And I'll have to say that after the delivery and then you're busy with the baby, somehow there's some amnesia that comes over and people come back again pregnant. So it's easier as it goes on. And, you know, it's part of our life.
Yeah, true.
There is pain, and I think a little bit so prepare yourself for that. To think you are going to have a completely painless labor would be not accurate.
Yeah.
You know, we have things to help you, but you're right. The further you can wait through your meditation and breathing to get the epidural, you're better off, because once you get the epidural, you can't walk anymore. And if you get the epidural, and you're like 2 centimeters, you're going to be in that bed a long time the first go around, waiting to deliver. And, you know, and like Tanya said, right, you have a C-section after, there are different issues. Like each of them has pluses and minuses.
Yeah.
You might really surprise yourself too. I mean, labor pain is a normal pain. Like you said, we've been doing this for millions of years, and this is your body going through normal function. It's not the same thing as the pain created by breaking your arm, which is an abnormal pain. So you might really surprise yourself in how well you do breathing through each individual contraction. You do get a break, so there is a recovery time. You know, especially in the early parts of the pregnancy, in the labor, when, you know, things aren't as intense, but you might really surprise yourself how well you get through it.
Thank you.
No problem. I see your question here about prenatal vitamins and morning sickness. I don't really have a specific prenatal vitamin that I'm drawn to. Anything that says prenatal vitamin on the bottle, I think is going to be good enough. We have a variety of them that are available for prescription. There's a lot of problems with insurances as far as who will cover what. So I would just say find something that appeals to you, that's a full, you know, like a prenatal vitamin complete, and it should be good enough.
Yeah.
As far as morning sickness goes, we have been using medication called Diclegis quite frequently. It tends to have the least amount of side effects and seems to do a pretty good job at controlling your nausea. Diclegis is basically just a mix of 2 over-the-counter medications, Unisom and B6. So just the vitamin B6. So you could try doing that, but if that's not working, you also want to chat with your provider as well. There's a multitude of different options and treatments available for this.
We also had another question about what about the walking epidurals?
Not really a thing. Basically, an epidural is numbing you from basically just below your breast to the upper portion of your thighs. And every epidural is going to be different for each situation. So if you have 3 epidurals in your life, all of them can be different. The idea of a walking epidural is that it's lightly dosed so that you have good mobility to be able to roll yourself over in bed and still have some element of perception that you're having contractions. But I don't know that getting up and walking around is necessarily safe, because your legs are not always trustworthy because of that anesthetic. So it's just nice being able to move around the bed and be able to feel it, not have that heavy, like I can't wiggle my toe feeling. So I think that's what's kind of referred to as the walking epidural.
Awesome, thank you. All right, guys, any other questions?
You know, you had some questions about morning sickness and all that stuff, and I really didn't get into the different trimester, you know, factors. Really, there's no different thing. Like you can do this during the first, but you can't for the second. But I think the first trimester is like a really unique situation where you may not be feeling your best. So, you know, not only are you nauseous, you could have vomiting, you could be struggling to maintain a healthy diet and drink water, but then also feeling super fatigued. I mean, growing a whole little human in the first 12 weeks is exhausting work. So you really need to make some modifications just to allow for that. If you're not eating and drinking properly, you should not be outside jogging. You got to think about the basics first. So, you know, prioritizing, you know, how you're feeling, making sure that you're healthy and strong enough to do any type of activity before you get started. So first trimester might be a rough one, but if you're able, you can definitely keep going.
And that nausea usually peaks at about 10, 11 weeks and then starts improving if you're somebody who gets that. And not everybody does. And not every pregnancy, it's Just each pregnancy is a little different.
Mhm.
If there are
I have a
no,
question.
oh, okay, go for it.
Thanks. Is it true that that there's a high correlation between feeling the morning sickness and the better outcomes for the baby?
No,
There's nothing like that.
if that makes you feel better, we'll go with it. So I would like that there's some gain for it, but absolutely not. It's a random event, and you could feel pretty cruddy, as Tanya said. But we do have a lot of different medicines, ginger tea. You know, we try everything and then eventually get the right combination for somebody.
Okay, all right. Any other questions, anyone, before we all hop off? All right, thank you, Tanya, and thank you, Janice, so much for hopping on today. I will let you guys know if there's any other questions I might forward along to you guys after, but thank you so much for your time today. Thank you, everyone, for joining.
Hey, yeah, hey,
Have a
our
wonderful
pleasure.
rest of your day.
Great job, Tanya.
Thanks.
Thank
Good luck,
you.
everybody. Hopefully we see you over at the hospital.
Definitely.
All right.
Bye-bye.